Good morning, everyone. This is Miss Nadine, and today we are going to start with Unit 9, Lesson 2, Advanced Surgery, Part 1. Our lesson objectives for today are: describe a theme-based picture and comment on it, supply missing information, and identify and correct false statements. To begin with, I need you to describe what is going on in this picture and comment on its future implications. It is clear that in this picture, two surgeons are monitoring the progress of a robotic surgery. There seems an incision in the patient's abdomen, allowing the robotic hand to get into the designated body area. This implies that advanced surgery depends nowadays on the assistance of robots. Little by little, robots would become full-blown surgeons performing all sorts of procedures. Robots are doing animal surgery on their own. Your loved one needs urgent surgery. But what if your local hospital does not have a surgeon who can perform the procedure? One day soon, there may be a solution. After years of robot-assisted surgeries in which skilled doctors pilot robotic instruments to increase their own dexterity and precision, we may be getting close to having robots that can actually perform these procedures unaided. Now kindly open your books on pages 229 and 230. Read paragraphs 1, 2, and 3, then supply the missing information to make complete sentences. Number 1. At present, a patient cannot be operated on unless. Number 2. Depends on robots performing surgeries unaided. Number 3. Is the process of surgically connecting two adjacent tube-shaped body structures such as blood vessels or intestines. And number 4. In the future, a fully developed robotic surgeon. As for number 1, the sentence can be completed as follows. At present, a patient cannot be operated on unless the hospital he or she is admitted to has a qualified human surgeon. Number 2, the bright future of surgery depends on robots performing surgeries unaided. Number 3, anastomosis is the process of surgically connecting two adjacent tube-shaped body structures such as blood vessels or intestines. And number 4, in the future, a fully developed robotic surgeon can handle difficult surgeries and perform perfect placements. Now kindly open your books on pages 230 and 231. Read paragraphs 4, 5, 6, 7, and 8, and then answer the following question. Identify the false statements and correct them so that they would reflect what is stated or implied in the text. Number 1. STAR has been used in surgeries in both humans and animals. Clearly, this is a false statement because STAR has been used in surgeries in animals only. Number 2. Robots are, in general, precise and they perform consistent stitches. This is a true statement. Number 3. Practically, human surgeons as well as robotic surgeons can perform the same three things: diagnosing a problem, getting rid of the problem, and closing the incision. This is a false statement because, in theory, human surgeons as well as robotic surgeons can perform the same three things: diagnosing a problem, getting rid of the problem, and closing the incision. Homework: do exercise A on page 232, exercise D on page 233, and exercise E numbers 2, 3, 4, 5, 6, and 7 on pages 233 and 234.